India, the world's most populous country, with over 1.4 billion people, faces various unique healthcare challenges. Among these challenges is the high rate of preterm births, the highest globally. The widespread implementation of specialized newborn care units at both district and sub-district levels has revolutionized treatment accessibility. Equipped with advanced life support and comprehensive care, these units have significantly improved the survival of premature babies, reaching even the most remote corners of the country. All the babies that could be saved are being saved. All is well, except it isn't. With these advancements came another challenge: retinopathy of prematurity, or ROP. This potentially blinding disease can lead to severe visual impairment if not detected and treated in time. Early and timely screening is essential. Breaking barriers, telescreening revolutionizing ROP care. Previously, only a trained ophthalmologist could perform ROP screening. But with the surge of telemedicine, various projects for telescreening in ROP have been successfully initiated across India. Notable among these are the Kid Drop project, the Vitalla ROP project, and the ROP SOS project. We at Aravind Eye Hospital, Pondicherry have also established a telescreening system. Over the past 4 years, we have screened 1,285 new and 951 review babies, diagnosing ROP in 248 of them, of which 79 babies required treatment, 51 with anti-VEGF and 28 with laser. Encouraged by the success of ROP telescreening, our next goal was to expand the service to more areas. We met few healthcare providers and called up few others, but all were reluctant, citing some or the other issue. The first barrier of lack of local support and funding slowed our pace. But then came a pivotal moment in our efforts.
Hello, I'm Mr. Param Sivam. I have been fortunate enough to sponsor some of your cataract camps in Koledam area. I've heard your team is doing great work in checking eyes of the babies, and that doing so can prevent possible blindness. Can you start it in our area too? I will take care of the transport and other charges.
This was our first break. Prior to initiation of screening, we met with Dr. Narendran, a medical officer at the Koledam Health Facility. This is where we met our second unlikely barrier. Despite being aware of the need for ROP screening, he was skeptical about the process and raised many doubts. We methodically addressed his concerns. We demonstrated how the RedCam device is used for telescreening. The transportation, setup, and imaging by trained technicians to capture and upload images for remote review was shown to him. Our consultant demonstrated the iTelligence software used for remote reporting. We assured him that any baby requiring treatment would be referred to the base hospital for confirmation. Detailed videos on injection procedures and laser treatments were shown to alleviate medico-legal concerns. By presenting data from our past work, we estimated the number of babies in his area that might have ROP. The significant number highlighted the urgent need for screening, convincing Dr. Narendran to support our initiative, thus overcoming our second barrier. We were now set to implement the telescreening program. On the screening day, we faced our third barrier: the lack of awareness of ROP screening criteria amongst the SNCU staff. All babies born that week were referred for screening. We had to meticulously review records to identify eligible babies, causing delays. Back at the base hospital, we developed an information poster and circulated a protocol among pediatricians in Koledam area, specifying inclusion criteria for screening. 1. Gestational age of 34 weeks or less. 2. Birth weight of 2000 grams or less. Screening was to be done before discharge from SNCU, NICU, or by 30 days of life, whichever is sooner. a recurring date for screening was decided. On the next telescreening date, the process went smoothly. Mr. Paramasivam was impressed and expressed his gratitude for our work. Together we can. By breaking these everyday barriers and revolutionizing ROP screening, we are taking small steps towards preventing blindness while helping these children take strides towards brighter future.